Hey, Dr. Kelly Starrett here with the TimTam. One of the things I want to talk about is the addressing of aspects of your sort of pain and dysfunction with the TimTam that you may not be thinking about. Sometimes when we think about muscles, we think of them as just sort of blind machines that are perfectly self-equalizing. That means that they slide back and forth and can immediately give slack or take up slack. One of the things that we know is that that's not true, that we often see areas of restriction inside the sliding surfaces. Like instead of pulling on my shirt, what ends up happening is I end up with a little knot inside the shirt. So when I pull on it, that trigger point or knotted up spot becomes a little bit more of a problem so that I don't get good even pull. It's like putting a dam right in the middle of my muscle function. One of the ways that we typically address this tissue dysfunction called trigger points is that we'll use constant pressure. We can also use a technique that we borrow from the PNF world of thought and rehab called contract relax. And one of the things that we can do is we can build tension underneath a localized pressure for a few seconds and then we can release. And that's a way of triggering our brain into restoring range of motion in our musculature. Remember, when we're addressing musculature, it's vital to keep in mind that the musculature is a neuromuscular system. Oftentimes when we see passive therapies, people like to really kind of crank on their tissues, or they overly massage them, and they're not remembering that the neuromuscular connection is the thing that makes this active system work. So before we showed you a technique called tack and floss, which is still an active technique that I'm moving actively underneath there. So I have a brain muscle connection. So instead of just taking the TimTam and just hammering away at what you think is a tender spot or a spot of restriction, it's much better to see if you can get your brain involved along with that passive therapy. And one of the things that you can do simply to do that is to try to create a connection by flexing the muscle underneath the area that you're working. So for example, if I had an area of my quadriceps that I'm working on and I press up and I find an area that's stiff, that's where I'm going to stop. And so right here, I'll keep the TimTam engaged, and then I'm just going to make a muscle. I'm going to contract the quadriceps underneath here for a few seconds and then release. And what we should know about normal tissue is that it should be relatively painless to pretty moderate compression, which means I should be able to push pretty hard on any aspect of my body, and it shouldn't hurt very much. In fact, it should hurt very little to moderate compression. So if I contract, if I find something that's stiff and I contract and I feel painful, I'm going to hold that contraction for 5 seconds and then I'm going to release. Also key here is thinking, hey, how do I know if I'm working too deep with the TimTam? One of our basic ideas here is that you need to breathe all the way in and all the way out as you're working. So if you're ever working on an area or a tissue and you find that you're holding your breath, you're immediately working too deep, which takes us back into this mind musculature connection. That if I'm holding my breath, my brain says that this is a threat and I'm not going to be able to access that part of my nervous system that's going to allow changes to happen in this contractile feature. So as I work on here, not only am I going to contract underneath there, and I'm going to relax, that tension on and tension off allows me to penetrate a little bit deeper, and I'm being able to connect the brain to the musculature, and also while breathing, I make sure that I'm not going too deep. So if I'm holding my breath, it doesn't work. If I'm just passive, it doesn't work. I want to be able to be contracting and relaxing, and when in that relaxed phase, I'm going to make sure I can breathe all the way in and all the way out. The last concept here is that a lot of times people will grab a soft tissue therapeutic device and they'll try to address a certain area. And what we want to remember is that any area is always part of a system. And so if I'm having stiffness or pain in a specific area around my knee, for example, likely is that this is not the obvious or direct problem. This is a problem where I'm having a pain response, and certainly addressing it to reperfuse the tissues is going to be important. But one of the aspects of this treatment that's so important is that I'm going to work upstream and downstream. So if my shin is stiff in the front here, that certainly can contribute to stiffness and tension in the kneecap or around the knee. If my quadriceps are stiff, that certainly is going to create higher tensionality in the tissues that may insert onto the knee. So I'm going to remind you, again, just to sum up, I want to be able to contract and relax into the implement as I'm working on an area. I want to make sure I can breathe in and all the way out to make sure that I'm not working too deep. And I'm reminding myself when I have an area of focus, I want to make sure that I'm also looking upstream and downstream of that area to think of theoretically feeding slack to the end of your spine. Again, using your brain you can get a lot more out of the TimTam than just blindly hammering your quadriceps into submission.